Obviously, having a bug inside of your skin is not ideal. Your first instinct is gonna be to crush it or to kill it. You do not want to do that. All of the fluid inside of that tick may have Lyme disease, and by squishing it or killing it, you're just re-exposing your body to everything inside of that tick. That's why you wanna treat it almost like an unexploded bomb. That's gonna minimize your exposure and reduce the risk of infection. If you find a tick in your skin or in your pet, you need to remove it. You'll see a lot of things online. This is what the Centers for Disease Control recommends. The first is to have a pair of tweezers. Any pair will do, but the fine tipped allows you to get as close to the skin as possible. Once you have your tweezers, make sure they're clean. You can wipe them with alcohol or use even a lighter or match to run the flame across. That just makes sure they're sterile and aren't gonna add any additional issues to the area where the tick has bitten you. You're gonna use your tweezers and place them as close to the skin as possible, and then just apply nice, firm pressure and gradually pull back. You don't want to pull too hard because you don't want to detach the body of the tick from the mouth parts, but if you just keep applying consistent pressure, the tick will release and you'll be able to pull it completely out. The reason that you don't want to cause damage to the tick is upsetting the tick or hurting it is going to cause it to release everything that contains Lyme disease inside of it into your body. You want to avoid that. You also don't want to leave the mouth parts of the tick inside your skin. They could continue to cause infection. For the same reason, that's why you don't want to put Vaseline or alcohol or a flaming match near the tick. These are all common home remedies for removing a tick, but they usually make the tick upset and cause them to release more Lyme disease into your body. Now, after you remove the tick, you want to clean the area where it was with either alcohol or soap and water. You then want to take the tick and either put it in a vial of alcohol or in some sort of sealed baggie. You can also take a picture of it. I recommend this because if you develop a rash later or any signs of Lyme disease, your prescriber is going to want to see that tick to see if it is a Lyme disease carrier. So don't throw the tick away before you take a picture.